All right, we're here today with Dr. Elliot Sloan, the recipient of our Robert L. Morris Humanitarian Award. Uh, we wanted to talk a little bit about GCEA because I understand you're on the board with them, and it has been a very wonderful collaboration with them over the years between AAMI and GCEA to have that international insight, that international impact. So, what's going on at GCEA? What are you trying to accomplish?
The Global Clinical Engineering Alliance is a society of societies. We have members from Peru, we have members from Saudi Arabia, we have members from Europe and Canada, and these are society members who have hundreds, and in some cases tens of thousands of clinical engineers and BMETs who are part of their society. And as Dr. Yadin David and I talked on the way to an AAMI conference in Austin, Texas, some years ago, the health technology management and clinical engineering community needs a global voice. We work with WHO. I've worked with WHO since 1978. But WHO is only a portion of the global voice related to health technology management.
Sure.
We have a tremendous partnership with AAMI because we have collectively, Tom Judd, Dean David, myself, and others, worked with AAMI for 5 decades. And AAMI is a knowledge source for medical technology excellence, for the maintenance and management of medical technology. And we're not reinventing the wheel at GCEA. With AAMI, we have been able to partner and do more with AAMI's material and expertise in markets that AAMI doesn't have the resources to work in. I think we first had an active program with AAMI in the International Clinical Engineering and Healthcare Technology Management Congress in Italy.
Yeah.
And then we had one at AAMI's headquarters during the pandemic. And in India, AAMI
Yeah, that just
was
happened.
very active. That happened a year and a half ago, and
Yeah.
that's 2 of the awardees this year who will be on the stage with me are from that organization, AMTZ, in a city called Vishakhapatnam,
Yeah.
that they can say easily that I struggle with.
I think you did it quite well.
They're a nonprofit organization. It's an incubator, a think tank.
Yeah.
They learn from AAMI. The world can learn from AAMI. We have helped AAMI produce summits on ventilators, on infusion pumps, on professional development.
Yeah.
And by translating these into 4, 5, 6 languages, we make that information accessible to our colleagues around the world.
I should say, one of Amy's strengths is as a neutral convener, but that also means that Amy cannot be strong without the people to convene. And that's really where GCEA has come in as a
Exactly.
friend and identifying for all these committees. Oh, this person knows this organization. They're the really ones you need to be talking to. And that has been so powerful.
It's important because matching technology to a particular locale. I've worked in Nepal, I've worked in Moldova, I've worked in Dominica, tiny, tiny countries with very limited resources. AAMI doesn't have the time to try to repurpose their material for the local needs. GCA doesn't do that. That's done by a community in Uganda or a community in Peru. We have these 45, 50,000 members that we connect with through WhatsApp, email, LinkedIn. We started this during the pandemic with an enormous. There are about 400 people that are part of a WhatsApp group that are ministries of health and hospital administrators and physicians. So it's been a great partnership with AAMI.
Sure. We love to see it. We love to see what what's coming out of this, what's spinning out the information, the sharing, breaking down barriers and silos. And I'm looking forward to seeing more. Next conference coming up and all that.
We have a conference coming up in China, and AAMI will be a centerpiece as a partner in that program in October.
So if you're watching, is there a save the date yet? I should ask.
It is roughly October 15th through the 18th.
Okay.
And I'll be there. I'll be there with Dr. David, with Tom Judd, and with our colleagues from AMTZ who are going to be receiving an award today as well.
Fantastic. And thank you for sharing.
It's a pleasure. Thank you for inviting me.
All right.